welcome to this episode of Let's Share series by I Love Children, a voluntary welfare organization who strives to be Singapore's one-stop portal for parenthood and fertility health. Today we have Dr. Janice Tung with us. She's a consultant ONG at Thomson Fertility Centre. She's a mummy of 2 and she delivered her second baby days after the circuit breaker ended. She's here to answer fertility questions you may have, so drop your questions in the Q&A section and we'll try to get as many questions answered during the session or through an article on ilovechildren.sg. Hello, Dr. Tong.
Hello, hi.
Hi, thank you for spending your lunch break with us. To start the ball rolling, could you share your experience delivering your baby days after the circuit breaker?
It was a bit quieter than my previous baby. Yeah, so there's fewer visitors. In fact, it was quite complicated to get even like your parents in, that we just asked them not to bother. So much quieter. Actually, it's better for rest. And then besides that, there was a bit of logistical issue also because of the choice of hospital. Your gynae can only deliver at certain hospitals. So I originally wanted to deliver at Thomson, but then in the end I had to deliver at Mount E, Novena. Yeah. So other than that, experience-wise compared to the first baby also was quite okay, quite the same. Yeah.
Does it feel safe delivering during the pandemic?
Yes, actually it is still safe, no issues. Because all the precautions and all that is all in place. I mean, Singapore, I think pretty much quite good standard of medical care.
That's good. Thank you so much for sharing your experience, Dr. Tong. And I believe this will address some of the concerns that couples may have while trying to conceive during the pandemic. Now, we have a few questions coming in already, so let's start with the first question. Okay, there's this attendee who is asking, is it normal for spotting to occur during ovulation and last for 5 days?
Okay, so yes, actually it can be common to have some spotting or bleeding even, and some cramps during the ovulation period, and it can last a few days. The thing is, we have to be sure whether you're ovulating. Yeah, because there are many other reasons for erratic bleeding. So one of the things that really give it away is how cyclical it is. That means that it happens quite definitely in the middle of your cycle usually, and no other periods of time. So this really gives it away lah, more or less. But for if let's say it happened randomly, then you do need to get an assessment by your gynae check and see if there's any other reasons.
Okay. Next question. I have been on the contraceptive patch for 2 years. Will the long-term use affect fertility, and how soon after stopping the patch can I try to conceive?
Okay, so the patch is quite similar to an oral contraceptive. Essentially, it's a combination of 2 hormones, so it's called a combined contraception. So in these cases, generally it's not thought to affect fertility in any way, except for the duration you take it because of your delay in, or rather your postponing of your plans for family. That is the age that affects it, not so much the contraception itself. So by right after you stop the contraception, your fertility should be returned back to what it should be at your age. And then usually what happens is that the ovulation will come back maybe within 1 or 2 cycles after stopping the patch or the pill.
Okay. How do you reduce the chances of miscarriage in the first trimester? And is spotting in week 5 a sign of a miscarriage?
Okay, I will answer the second question first, which is the spotting. Well, spotting is not a sign of a miscarriage. Miscarriages can happen with or without spotting. So there are many what we call silent miscarriages. That means the pregnancy just stopped developing halfway, even without any sign at all, no spotting or bleeding. And a lot of ladies with spotting or bleeding in the pregnancy, about more than 80% of them is going to carry on to have a normal pregnancy. So I would say that there's no way you can judge by spotting alone whether the pregnancy is at risk of miscarriage. Okay, then the first question, how to reduce chances of miscarriage in the first trimester. Unfortunately, if let's say your lifestyle habits, for instance, smoking, no excessive alcohol, coffee you're limiting to 1 cup a day, as well as your weight, if you have no other weight issues, then generally there isn't really much you can do to improve your or reduce the chances of miscarriage. Okay, the other is, because miscarriages are generally very common. Most ladies, at least 1 in 5 or even 1 in 3 women may experience 1 or 2 miscarriages in their lifetime. And this is due to the fact that the genetic health of the pregnancy is not there, it's genetically unhealthy. So this one you cannot do anything about. I mean, it's genetics. Yeah. So the other thing is what are the possible reasons behind your miscarriages. In some cases, there are thyroid conditions, there are other reasons such as some clotting disorders that might result in you being more prone to miscarriages. In such cases, if you do have repeated miscarriages, you should get a consult with your gynae and get workup to see if any of these reasons are behind the miscarriage. And then those conditions can potentially be treatable before your next pregnancy.
Okay. This is a very hot topic because right now we are all going through this vaccination drive. So someone is asking, is the COVID-19 vaccination safe to take if you are trying to conceive?
Okay, so currently, out of an abundance of caution, the advice is to wait 1 month after your last dose of vaccination before you start to try. Now, depending on your age, this advice, I think it depends. Okay, if you're in the older age group where you cannot afford to wait too long, then I would suggest that you can go ahead and try. Okay, because I mean, the chances of conceiving with 1 cycle is not very high in the first place. And the second is that there is technically no reason for the vaccination to be unsafe itself during pregnancy, which means that if, let's say, you inadvertently fall pregnant between vaccination doses, for instance, there is no reason to terminate the pregnancy, for instance, and there's no known impact on the pregnancy. Okay, so the only thing is that because data is limited, obviously, at this stage, therefore, this is the advice to wait 1 month until after the second dose of vaccination. The other thing is also that if, let's say, you fall pregnant between doses of vaccination, it will render you being unable to take the second dose and therefore having to postpone the whole course again. So that is the other reason. Logistically, it is a bit more inconvenient. Yeah, but that would be the reasons. There isn't real impact on the pregnancy, at least as far as we know yet.
Okay. Okay, and how do I know if I have PCOS?
Okay, so generally polycystic ovary syndrome is a condition where a lady doesn't ovulate. Most of the time, this lady has many eggs, but they're not coming out in the cycle. It tends to be associated with ladies of a heavier weight, okay, but it can also happen even in ladies with normal weight. Okay, so the thing is, the ovaries on the ultrasound will show many eggs, okay, but none of which is coming out. The second thing is there will be some hormonal blood tests. Generally, sometimes your male hormone may be a little bit raised. There's a hormonal imbalance as well, and your menses can be quite erratic, so it can be it may take very long before one menses happens. Okay, so generally for this group of ladies, they are not usually ovulating, although it's not 0% chance of ovulation. I mean, sometimes on and off they can ovulate, you just don't know when, so it makes it very difficult to try. So it's not saying that polycystic ovary syndrome completely no natural chance of pregnancy. Sometimes lucky can get one. Okay, but generally if you do have it, it makes it difficult for you to try, so therefore you should see a gynae, get treated for the condition, get you ovulating regularly so that you may try to conceive as soon as possible.
So what are the treatments available for patients with PCOS?
Okay, so mostly one is lifestyle to if you are of the heavier side, then to try and reduce weight through diet, exercise, especially if you're very young, because that will help you to stay off medications overall. Okay, then there are some medications and supplements that you can take to improve overall egg quality, as well as to stabilize the eggs for ovulation, and some metabolic medications that are sometimes we give to diabetics, but can also be given to ladies with polycystic ovary in order to improve their chances of ovulation, because it's believed that the polycystic ovary condition happens because of some metabolic issues. Okay, and then finally you can give ovulation medicine for trying for pregnancy. So the ovulation medicines can be in oral form, can be in injections as well.
Okay, there's this couple who asked, we are newlyweds and we have not had intercourse due to penetration difficulties. Is there anything we can do?
Okay, so you will not be the only couple. So there are quite a lot of couples facing the same issues. So yes, certainly there are things that can be done. A lot of it is actually some mental conditioning, some mental exercises, some physical exercises as well. Okay, sometimes we work hand in hand with sex therapists as well. Okay, to address the psychological issues behind all this as well. Okay, so it is definitely treatable. Okay, and as for conceiving, generally we can also deal with the issue by doing home insemination methods with a syringe as opposed to having sexual intercourse itself. So we can, it works hand in hand. The penetration for sex itself will be a bit more difficult than a syringe insertion. So that will take longer. But instead of postponing your plans for children, you can always do a syringe method first as well.
Would you say that toys would actually help with such cases?
Yes, so certainly, actually for the physical exercises that I mentioned, we are using vagina dilators, which in a way is actually a sex toy lah.
Okay. All right. Okay, another couple asked, we've gone for a fertility health check and my husband's semen analysis is clear, but I'm not ovulating. So what can we do next?
Okay, so I believe this question, I mean, along with the polycystic ovary syndrome, the treatment is essentially quite similar lah, with to try and get you to ovulate. We deal with ovulation medicines either in the oral form or in the injection form.
Okay. So right now, okay, can UTI affect my chances of getting pregnant?
No, it depends on how, the short answer is no. But it depends on how repeated your UTI. If you're getting UTI very frequently after intercourse, it may put you off intercourse, and therefore your frequency of sexual intercourse will go down and also affect your chances of conceiving in that case. So if that's the case, you need to address this issue with repeated urinary tract infection. But otherwise, in itself, a UTI is not going to affect your chances of pregnancy. However, UTI during pregnancy can be associated with preterm labor, and so therefore it needs also to be treated.
Can small uterine polyps cause infertility, and is it a must to remove?
Okay, so uterine polyps, right? Okay,
Polyps, yes.
so small uterine polyps, generally we do not really know their true impact on natural fertility. It is thought that it may not have very much significant impact. We don't know because people who conceive naturally generally do not have previous scans. You do not know whether they had polyps previously or not. And then after the pregnancy, if they miscarry or anything like that, it's also hard to assess whether they previously had polyps before the pregnancy. So this makes it very difficult to answer this question. However, we do have studies done on our IUI as well as IVF population groups. And in general, these ladies, we find that if we see if there's suspicion of polyps on the scans beforehand, we go in with a scope and check for polyps and remove the polyps, their chances of pregnancy improve with the next treatment. So by extrapolation, there probably is some impact of polyps on fertility. But if you're young and you have some small polyps found, by all means, you can try naturally for a while first before considering surgery. If you're in the older age group, the other reason for removing polyps would be to check whether there's any abnormal cells within the polyp, such as cancer.
Okay. Okay, another question. Sounds like a secondary infertility. So this lady, she had her first child naturally, and after 1.5 years, she had a miscarriage, and she couldn't get pregnant ever since. She has done 3 IUIs and 1 IVF, which has all failed. So she's trying TCM right now. She is 39 years old, going on 40. So is her chances of having another child low? So what else can she do?
Okay, very unfortunate. The thing is, based on her current history, yes, her chances of conceiving is actually very low because, I mean, there are failed treatments. So we know generally there is an issue, and it's very likely to be due to her age. The quality of her eggs and her husband's sperm probably as well is not good. Yeah. So the thing is, in such cases, we have to rely on statistical chance, which means that on the off chance that one of these eggs, because basically when we say the egg quality is not good, right, it means that maybe if you have 10 eggs, one egg is good and the rest are not. So chances of not conceiving, not having a miscarriage when you're pregnant, all these are higher. But that 1 out of 10 chance, you have to try for it. So, which means that either you are trying naturally when you're not doing any treatments, or you continue to pursue IVF, because IVF still remains the fastest means of trying, because it extracts all these eggs at one go and then fertilize it, and then we put the embryos back. We don't really have control, of course, how good these embryos are, but at least the chance is there.
Okay. This question is it possible to not ovulate even though she has regular menses? And what is the reason for not ovulating?
Yeah, there's a small percentage of ladies who's having regular menses but was not really ovulating. Reason why, we do not know. Okay, but generally the treatment is still the same to address the ovulation with medications. We can look into other things like weight, underlying medical conditions, like for instance thyroid, and as long as these are checked and ensured that it's normal, then there's no really further treatment.
Okay. Are there any supplements for the man who has low sperm count?
Okay, so for low sperm count, okay, there's low sperm quality as well as low sperm count. Okay, by all means, low sperm quality is generally a lesser problem. Okay, so for these, there are just general vitamins that they can take, which is antioxidants. Okay, such as vitamin A, C, E, zinc, selenium. These are generally found in a lot of men's performance multivitamins. And there are also prescription vitamins to help with fertility for these, but they are all essentially the same thing, which is antioxidant multivitamins. Then for those with low sperm count, is generally a more serious problem, depending on how low the sperm count is. And sometimes it may not be a prudent thing to wait for it to improve before you do something about it. So for instance, IVF treatment for low sperm count. Okay, but in the meantime, of course, you can try fish oil supplements. Those high dose fish oil supplements. So for ladies, they take a lower dose fish oil. For men, generally for sperm count, usually we would recommend about at least 3,000 mg of DHA a day.
Okay. Will the removal of cysts affect my chances of getting pregnant?
Yes. Okay. Now there's a two-part to this question. One is depending on the type of cyst. If it's an endometriotic cyst, then there's an underlying condition of endometriosis which affects fertility overall. Okay, women who have endometriosis generally have lower chances of conceiving, or take longer to conceive, whether they're trying naturally, IUI, or IVF. The other second part of the question is, yes, removal of any cysts generally may affect the normal ovarian function, because some normal ovarian tissue is going to come off together with the cyst. Okay, so that will affect your ovarian reserve and your egg counts, and that may affect your chances of conceiving. Okay, egg count itself doesn't really matter in natural fertility because every natural cycle only one egg comes out. So if you're young, generally chances of ovarian cystectomy affecting your chances are low because your egg quality is still good. No matter how many eggs may be left, you will still have one egg coming out and the egg quality may be good. But if you're older and chances of doing IVF may be higher, then IVF relies a lot on your egg count. The healthier your egg count, the more chances there are because we can extract these eggs out. We can't generate new eggs with IVF. We have to take from what you have. So if you had previous cystectomy, you're in the older age group, you're considering IVF, then yes, the doing a cyst operation would probably affect your chances.
Okay. Are there any symptoms if one has blocked fallopian tubes?
No. The short answer is there can be no symptoms. Okay. In some ladies with endometriosis, they may have pain. Okay, as in endometriosis, the reason for the blocked tubes. In some ladies with prior pelvic infection, that means infection of the womb, ovaries, which can go undetected, they may also have chronic pelvic pain. So that can possibly be one of the symptoms of blocked tubes. But generally, it's not always the case that there is pain.
What are the chances of conceiving after 40? Should the couple consider ART?
Less than 10%.
Okay. All right. We have another maybe another 2 questions. Okay. How will LH test kit be effective for women to monitor ovulation? And this person has irregular menses. And will acne be acting up when LH is low or high?
Okay, so the thing is, if you have acne and irregular menses, you do need to get evaluated to see if you actually have polycystic ovary syndrome, because then people with this condition actually more prone to having acne. So if that's the case, then in terms of monitoring your own LH and ovulation and trying will make it really very difficult, okay, to try. So the thing is, if people who should, I don't like to use the ovulation test kit. The possible reasons why I will ask ladies to use ovulation test kit is those who are probably ovulating regularly. We are relying on the ovulation test kit to actually tell them when to inform them when to stop trying. Okay, because it's actually more important to start trying before ovulation actually happens. Once the ovulation test kit turns positive, it's actually a bit too late to try. So we just use it to try and let them, inform them when to stop trying actually, rather than to start trying. So a bit difficult in her case if she's trying to rely on it as to try. Yeah. Okay. Then the other thing is, she asked about, sorry, does LH spotting, is it, or what?
How do you use
Oh, the
LH?
acne more likely whether
Yeah.
okay, so acne is okay, if you're not ovulating, the acne is generally due to the slightly raised male hormone and the hormonal imbalance as opposed to high or low LH. Okay, people with polycystic ovary, they generally have quite high levels of LH overall in the cycle. It doesn't there's no surge for the ovulation to happen.
Okay. This participant has difficulty with ejaculation. Is there any way to improve it and improve the chances of a natural conception?
Okay, that depends on the reasons for him having difficulty ejaculating. Does he have difficulty maintaining an erection in the first place? Okay, in which case there are certain treatments available for that. Is it psychological reasons? Because there are a lot of men with actually some performance anxiety, and that's normal. And that can be dealt with also with a bit of counseling, some physical conditioning and all that. And is it that he can maintain an erection but has problems ejaculating, then that is another problem altogether. Okay, so sometimes vibration stimulator toys can be effective. So he may be able to try that. Yeah, short of which, if you really cannot achieve ejaculation easily, then IVF treatments with either vibration ejaculation or electrical ejaculation can be obtained to obtain the sperm specimen for the treatment.
For patients who have difficulty tracking their ovulation days, what methods can they try, especially those with PCOS and irregular periods?
Generally, for those ladies with PCOS or irregular periods, I would prefer that if let's say time is of the essence, then to try ovulation medicine and then try with ovulation medicine rather than natural trying to track. Okay, but if let's say you really want to track, you can use any number of methods. Basal temperature taking, basal body temperature taking. You can try to detect the changes in your discharge. Okay, generally about 5 to 7 days before ovulation, the discharge should be a bit more slimy. Then sometimes during ovulation, you get a bit of spotting or cramps also, so you know. Other methods will be using the ovulation test kit. But as I said, it's going to be difficult.
Okay. All right. This couple has been actively trying to conceive. What kind of lubricant would affect the success rates?
Okay. No, we don't know which lubricant will affect success rates, but generally water-based lubricants is thought to be better than oil-based lubricants and better for sperm. Okay, there is certain lubricants that they sell on the market that promotes, that presumably they market as promoting sperm health and all that. I will take those with a pinch of salt. It's not necessarily better than any other water-based lubricant.
Will sexual position affect the chances of conceiving?
In some ladies, yes. Generally, most ladies, more than 70-80% of the ladies would have a normal tilted womb. Okay, so in which case a missionary position or any other position would be fine. But there are some ladies with a retroverted womb. Okay, so that means the womb is tilted backwards and away from the urine bag. In those cases, sometimes the cervix is more pointed forward in the vagina, and we would prefer that doggy style is better, or lying on your front in a prone position after intercourse is better, because we want the sperm to pool in front of the vagina.
Okay, we have one last question because our time is running out. Okay, can I do vigorous exercises involving many jumps if I'm trying for a baby?
Oh, well, generally the short answer is yes, it's okay to do so. Unless you're doing things like IVF treatment, where we are worried where the ovary is enlarged because of multiple eggs, then we will advise not jumping around, because sometimes the ovary, when it's enlarged, can twist on its own and cut off the blood supply to the ovary. Other than that, no issue definitely with doing vigorous exercises while trying at any one point of time. But if you do know you're pregnant, you may want to take it a step down.
Okay, thank you, Dr. Janice Tung. Do you have any words of encouragement for couples who are trying to conceive and also couples who are facing fertility challenges?
Generally is to keep trying. Take things step by step, keep the communication open with your partner, have your own goals, time frames, or so that you don't get because when you're trying, it's very disappointing every time either your menses come or your urine pregnancy test is negative for that cycle. So it's understandably difficult. So the thing is, if you have certain goals, time frames, you will be less stressed about this, and you know your action plan is just to move on. You see, then you can get your gynae consult. Get some fertility workup done, and then you can face the problems head on. Okay, for the ones with unexplained difficulty, that will be generally the harder group, because essentially, because all the tests come back as normal, there's no real reason, then you have no choice. You have to keep trying on your own or go on to IUI and IVF treatments, not knowing whether it will succeed. So the thing is, for this group, as I mentioned, really don't give up. Just you have to keep trying now. If you are young, generally we will be fairly confident you will have a child either way, whether through fertility treatment or natural trying at some point.
Would you recommend also fertility health checks for couples who are trying to conceive?
Yes, certainly, definitely.
Okay. Thank you, Dr. Tong, for this very fruitful session. We've come to the end of this session, and if your question has not been answered, we will try to get them answered by Dr. Tong through an article on ilovechildren.sg. Now, remember to complete the feedback form at the end of this session for a chance to receive a fertility kit from Point of Care International worth $23. Join our Fertility Support Group Singapore on Facebook for the much needed peer support while trying to conceive. And Dr. Tong is also on our panel of experts in the support group. Follow us on Facebook and Instagram at ilovechildren.sg and keep a lookout for our next webinar on finances targeted at couples trying to have children. Together with Dr. Tong, thank you for spending your lunch break with us. Thank
Thank
you.
you.
Goodbye.
Thank you for the invite.
Thank you.